Professor. Thank you so much for accepting the interview invitation to our channel. Let's start about COVID. So there is a new outbreak now in China. Here in Shanghai, some venues are locked. Some other places in Jilin, high number of cases. What exactly is going on?
That's a good question. Right now what we're seeing is, as you noted, very large surge in cases in Jilin, a relatively modest number of cases in Shanghai. I think if we look at the number of cases in Shanghai and the incredible response that we've seen here, it would befuddle a lot of people internationally. Of course, a lot of this seems to be traced to Hong Kong, where they lost control of it to begin with. And there's some suspicion that some of the cases that we have here in Shanghai were imported from Hong Kong, that there was a failure in a quarantine hotel. But we also see lockdowns in Shenzhen now. So, the policy in China is called, it was originally called zero COVID. Now it's called dynamic zero COVID. And I'm seeing now a new translation called dynamic clearance. And what this means, I think, is that we've seen sort of an evolving policy. So, for example, we saw this very difficult lockdown in Xi'an and Tianjin earlier this year. And so as we've encountered these problems in Shanghai, one of the questions is this a Xi'an-style lockdown? And it doesn't appear to be one so far. That may change because it is a dynamic process. But we also know that the capacity to clear, to do tracing, to do contact tracing and small-scale epidemic control is much more robust here in Shanghai. So what we're finding is, that China built this incredible apparatus. I mean, you've been here, you've seen all the apps, all the ability for them to really follow people and trace people, the travel codes, both the local health code plus the travel code. So they've built all this capacity, and now we've really reached the big test, right? And so a lot of people are thinking, well, maybe Omicron is going to be the one where they quit. But I think Omicron is where they really want to test it. And so I think we're going to see in the next month or so them doing everything they can to try to hold down the infections. Part of it is an experiment to see the limits, because this isn't going to be the only outbreak. There's a lot of models that indicate that we have more outbreaks coming. Maybe not necessarily more mutations related to COVID, but that COVID itself is probably directly related in some substantial way to global warming. So, there were models that had predicted something like COVID was coming, and because of global warming, more will be coming. So China isn't just, trying to learn how to control this one, but also future outbreaks. So this is the first thing that we're seeing. And from the models that we've seen, for example, a model that was just published by Lanzhou University, they think that this current outbreak can be contained, that will reach somewhere around 35,000 cases domestically, but it will be contained sometime by early May. Now, this is important because
I was hearing some people saying 1 week, 2 weeks, this could be controlled. You were saying by May.
I'm saying China-wide. Okay, so it's probably going to take them longer to get Jilin under control, and we'll see whether or not they're going to be able to really lock it down in Shanghai or not, right? I mean, this is Omicron is something that moves a lot faster. And because we have so many people now with vaccines, we have a lot more asymptomatic cases. So it's not so easy to track. The only way you can find it is through mass testing. So, yeah, I think that the key point here, though, is May is kind of an important thing, because in my thinking, I think China is going to start relaxing some of the controls.
Relaxing.
Modestly relaxing. This is my guess based on what I can see. Sometime around May or June, and they're going to do this because number one, they want to align more with the international community. They know that not having travel, that not having access is having a severe impact on them. that the Chinese people themselves are also feeling increasingly pressured and unhappy with this. Furthermore, I think what they're doing is they're looking at the intersection of 3 or 4 points. One, that they will be able to produce and have wide access to the new drug treatments. So that plus the warming weather, which will see a decrease in cases. This current outbreak is actually encouraging those last holdouts to get vaccinated. So all these things, I think, are coming together. The social pressure, the need to align with the international community, the warming weather, plus the new treatment regimens, which means that if they can get past this one last push, I think they're going to, get into a point come summer where they're going to probably open up a little bit. So we'll see more, like if you have families or people who are doing business, it'll probably be a little bit easier to green channel in. I don't think we'll see a wide opening. I think it'll start slow, and they'll see how that works. It'll probably be, coming into certain cities that have shown competence. And then if they can control that, and we don't have, hopefully any more major mutation outbreaks, then maybe we'll see something normalize. The other thing I think that we'll probably have to look for is a new vaccine, a vaccine update. Maybe that'll come sometime in the summer or early fall, but hopefully.
Yeah, 2 questions about, you said this current outbreak, I didn't read anything in the news about it's Omicron, it's Delta, it's a new variant. What do you know about it? Is it confirmed that it's Omicron? Is it possible there is something new?
Yeah, everything that I've seen indicates that it's Omicron. Yeah, I don't see that it's the new one, the Deltacron, is that what it's called? Yeah, I don't think that that's what we're looking at. I think everything that I've seen so far is that it's Omicron, and that it first broke containment coming out of Hong Kong. I don't know about the Jilin cases, but from what I understand in Shanghai, it's Omicron.
Yeah, so most of the cases now are in Jilin, in the north of China, but many cities, more than 70 cities, are contaminated, let's say, by the virus. And you mentioned there's some kind of social pressure for the Chinese government to open borders. Is really like coming from Chinese people? Do you think they want the borders to be closed, open? Because I hear from friends they don't want. Also many people afraid because abroad there's so many cases, and they prefer, like China has a tradition, like they have the Great Wall, they have some tradition of being more closed and protecting themselves against what's going on in Europe or in other countries. So how do you see this? You think the majority of the people here, they want the borders to open or close? What this kind of pressure that you mentioned?
Well, there is, as you know, having lived here for many years, there's always a little bit of xenophobia, right? There's always a little bit of a fear of the outsider, or even a type of ethnocentrism, right? That and we don't always feel this in Shanghai because Shanghai is so open and international, but it's certainly more prevalent in other parts of China where they have very little interaction or business internationally. And I think that we have seen this narrative that's been unfortunately true to some extent, but also in the reporting that we see from the Chinese government, that the cases that have come to China recently, they've all been imported cases, and so. And China wants to try to explain, well, this is not because of something we had going on here, but because of something that was imported. And so then Chinese people are like, well, why are you letting people in, right? And of course, one of the things that Chinese people don't realize is that a lot of the people who are bringing it in are Chinese people themselves, right? So people coming from Hong Kong is part of China. These people have a right to come to China, but also Chinese who are abroad. Chinese who have a vital business interest, or students who were brought. We had this one case in Shanghai a month or so ago where we had lockdowns where a girl came back from study in the United States, and she didn't closely follow. This is the what was talked about in social media, that she didn't closely follow the quarantine regulations on the self quarantine third week, and didn't test positive until like the seventh day of that. But by that time, it kind of spread it to some friends. So this isn't really kind of a foreign problem. This is more, China is now a global nation, and it lives and breathes in the global economy. And so I think this is something that Chinese people are going to have to come to terms with. But yeah, at the same time, I think the government will be able to sell that need and that necessity, change that emphasis when the time comes.
So we can be optimistic about opening borders in 2022.
I think that we will see a modest relaxation, and we'll see maybe because right now the way they control is there are certain rules on who can get what they call a PU letter, right? And so there are rules related to which industry you work for, what your rank is, how much investment you have, right? This is how they're trying to determine sort of your essential status. But my guess is that the first pressure that we're already seeing are Chinese people who want to go and come back. And this includes, and then secondarily, people who have permanent residency, right? So there are people who have to travel who are going to need to come back. And then we'll see, following this, people like myself who have family members who want to rejoin me here, who currently are restricted from traveling or entering China. And so I think they're going to prioritize, but I think that what they'll do is they'll gradually loosen the restrictions so that they, but I don't see tourism, for example, this year
Boosting,
yeah. But the real key issue is China's vaccines. I don't know what's really being reported right now, but increasingly it's being recognized that the Chinese vaccines are working, and they're really preventing mortality above all. In fact, they prevent mortality better than the RNA vaccines. And that's been one of the standards that China has focused on, is that the mortality rate can't exceed seasonal flu. So if we have vaccines that are working, if we have drug treatments that are coming into the marketplace, if we have no massive rebounding cases that are threatening medical system collapse in different areas, if we're, then people are going to say, okay, why are we still afraid of this? Why are we still locking down? Why are kids not allowed to go to school? Why aren't we allowed to travel? And so that's when I think the government has to relax, and I think they will.
Okay. So